This is Damon Dash, and this is the Dash Diabetes Network. I might not be a doctor, but I'm definitely in a doctor's state of mind. As a diabetic, I think it's important to make sure everyone knows that it's nothing to be ashamed of. It's a part of my lifestyle, so any innovation I have, I showcase it. And whenever I do that, like on Instagram or whatever, those are the times I look at the comments. And there's always these comments about how if I change my diet or approach things different, or did it maybe holistically or just a different approach, that I could cure 100% my diabetes. And I'm type 1. And, I thought it was important to get both perspectives from a traditional doctor and from one that's not so traditional. So what I'd like to do is, I'd like you two to introduce yourselves, and then I'd like to have this conversation.
So my name is Dr. David Kane. I went to medical school at a place called USC, and I did my postgraduate training at UCLA.
I'm Laila, Africa. My area is non-traditional, as you call it, which is naturopathic medicine. I went to school in Europe. I went to medical school to be a doctor, but it didn't gel with me. And I went to nursing school, and I was a nurse in the military and a psychotherapist. And I've been in this business about 30, 40 years, since 1970. And I've treated diabetics and high blood pressure, cancer, and all that sort of thing.
All right, so the number one question I want to ask, I'm diabetic, I'm type 1. Can you cure diabetes type 1? And if you have, do you know any cases that this has ever happened?
Type 1 diabetes, the cure is right now not here yet. However, the closest thing they have for cure is the transplants, whether it's whole pancreas transplants or islet cell transplants. So yes, there have been a few cases that I've had that have been cured, and they have been transplants. Okay.
They've been transplants?
They've been transplants. So islet cell transplants, the cells that you are missing that make insulin, are the beta cells, the islet cells, and you can get those transplanted. However, there's not a lot of pancreases, and the success rate is also very low right at the moment. And there really isn't a lot of human pancreases available. The biggest problem is that you have to be on immunosuppressive therapy.
Right.
And the immunosuppressive therapy is far more dangerous than diabetes.
Right.
So therefore, the average type 1 diabetic, we don't offer them that sort of treatment. So right now, that's the closest thing you have to cure. So what we have that is the closest thing is giving you insulin, and giving you insulin in multiple forms. So right now we have, I'm sure you've heard of the insulin pumps.
Right.
Okay. And coming out this year will be the, it's a hybrid. It's not a fully automated insulin pump, but it is what we call a hybrid. It has a sensor attached to a device that delivers insulin, and it plays back and forth based on what the sensor readings are, giving more insulin, giving less insulin. Then we have, of course, the injectables. And traditionally has been, that I'm sure we're on for many years, was a long-acting insulin called your basal insulin, and your fast-acting insulin, which you took at meals. And what you're trying to mimic is the natural release of insulin from the body. We don't do a very good job at it with those regimens, I will confess, but that's all we got. The biggest problem with the fast-acting insulins is they are not fast enough. So what has happened is we now have inhaled insulin. People go, oh, inhaled is great, you don't have to take a shot, but
That's what I'm using.
Exactly, and that's what you're using. It's called a Frieza. But why am I interested in it, and why is my patient interested? Well, is it that they don't have to take a shot? That's an advantage, but it's super fast. It peaks in about 10 to 12 minutes,
right.
Which is, if you eat a concentrated sugar, whatever even if it's juice, for example, your sugar goes up, and you can't take an injectable insulin fast enough
to catch it.
However, with this inhaled insulin, this Afrika, you can get about as physiologic a level of insulin as possible, and that's what's been so unique. I mean, it's really quite innovative. We've been doing it about the past since Afrika came out. and it's been quite remarkable. Patients are coming in. I mean, taking a type 1 diabetic, granted it's not the cure, but we got you down to 1 shot a day. Pretty darn good.
Is there a way to cure type 1 diabetes?
I can only cure ham. He can't cure it, I can't cure it. Now, where you gonna go from? You wanna take all these drugs or you wanna do a natural process to help yourself? That's your choice.
So I guess what I'm asking is, can you make it where you don't have to take an injectable insulin or another
I
form
can
of
get to
insulin?
that point,
Get
but
to
it
that
takes
point.
a lot of work.
As a type 1 diabetic, you can make it where if you have a manageable lifestyle,
Yes.
you don't have to take any
I can
insulin.
get there, but it takes a lifestyle change.
Here's the thing. If you change your lifestyle, we can reduce the amount of insulin you need. But to get you insulin free, you don't make insulin. You don't make insulin. You don't make insulin. You'd like to be able to not take insulin at all. And I don't think you can get there. You can get there taking a lot less.
He said you could get there.
Here's the thing.
Did you not say
It's
that?
all if you're making it.
I don't want you to grill him. We in two different arenas. You asking him the rules of football, and I play tennis. You got to ask me tennis rules.
That's not what I'm asking.
I'm in a different rule.
I'm not asking different rules.
You
All
can't
I'm
ask him to
asking,
explain the game he doesn't know. I can't explain his game.
all I asked was, can you, in any form, way, fashion, shape, or form, make it where a type 1 diabetic does not have to put any insulin inside their body? That's all.
In his field, yes. That's his field. So you keep asking his field. So
Right.
why you have me here?
But in your
you want to
field-
know about my field? Let me talk about it.
Yeah,
Let me talk about it.
I'm listening. But
Okay.
that was the question I wanted to know.
Well, we both agree. We both agree, and we're telling you we're agreeing.
He didn't say that you could. He didn't say that you could have that you would have to. You said you have to take some form of insulin. Maybe
That's
less.
correct. And
Yeah.
I agree. In his field, I totally agree. No argument.
And in your field too.
I just told
His
you.
field too.
I just told you.
If you go on his field, do they have to take insulin?
He doesn't know my
I don't
field.
know his field.
What's the name of your game?
Naturopathic medicine. Got it? Now, let's go back into naturopathic medicine. It means the pancreas has a disease, and one of the diseases is diabetes. You keep talking about diabetes. That's not the only disease of the pancreas. Peeing a lot is another disease of it. That's why the Greeks call it diabetes. I pee a lot. That's what it means.
You've said I pee a lot.
Yeah, because you keep going into this thing, and I'm saying that's one.
I'm out of that thing.
Sugar is related to love and affection. You associate sugar with your birthday, with your mother and father. If you're having problems loving yourself or loving someone that looks like yourself, you're going to eat sugar. Sugar is needed to get out of a crisis. The crisis may be the ghetto, your lifestyle, anything. Your sugar has to go up to get you out of the crisis.
What's next after that?
The next thing is your mouth got you in this trouble. And you don't taste with your tongue, you taste with your brain. You don't touch with your fingers, you touch with your brain. Your ears don't know what it's hearing, your brain knows what it's hearing. You hear with your brain. This is a whole other way of looking at the body. I'm saying your brain, something emotionally happened to you to get out of this situation. You needed more love, more affection. So sugar's associated with love and affection. If you're in a crisis, your sugar has to go up to get you out of the crisis. The crisis could have been your lifestyle, could have been your family. So you are already set up for a precondition to have diabetes. I'm telling you, this situation you are in as a black person sets you up to have diabetes.
So moving forward, then what do you do?
Moving backwards, this is what I'm trying to tell you. Sometimes the biggest step is to go backwards, not forward.
So first you got to move backwards.
Yeah, we got to go backwards to see what happened
So
to
that
set you up in this
that-
condition
that
and
is-
get rid of that condition to set you up. Or else you're going to repeat it over and over again.
So once you do what you could have prevented in the first place, you have to fix that, and then you have to go into the diet part.
Yeah, which is not a simple process because you get addicted to your lifestyle. So in any case, I got to go through all of this stuff. It's a whole lifestyle change. Everybody can't be saved. Maybe you're one of the people that can't be saved. I don't know. From diabetes, high blood pressure, heart attacks, strokes.
So this isn't really about just me. This is about everybody.
That's why I go around the world talking like I'm talking
No,
now.
I got it. So let's say there's someone else that doesn't have that has the discipline to do it. What would that then entail?
That would entail understanding their body from another perspective, my brother. Because in my area, we do not view inflammation as an illness. We view it as the body trying to be well.
Does the natural process cure it?
I just told you, I cannot cure anything, but I can help you have a better understanding and a better quality of life. That's all we're talking about.
So,
You want a better quality of life at this point.
So like I said, I think it's important that open discussion happens, open dialogue for different perspectives, especially as it relates to health. I think everything that was said was impactful. I think you can listen. I think you can judge it for yourself and apply it the way you want to. I know what I'm gonna do. They know what they're gonna do. And at the end of the day, we're all full grown and we have the opportunity to make decisions and do what we think is right for us. So with that said, I thought we had a great time and it was informative. Health as well. If you want to learn more about being a diabetic and being cool while you're diabetic and the lifestyle of a diabetic, check out the Dash Diabetes Network. Holla back.
I'm amazed. I didn't know anything like this existed.
I like it.
I like this idea.
We showed people with diabetes something they'd never seen before. Inhaled insulin.
It's inhaled. Now I would consider this.
I could inhale it.
And you said you inhale it?
It's neat. It's really neat. I like the design. It's very fascinating.
I don't know. I don't have the right words for this.
I'm going to talk to my doctor. I'm going to find out if this is something that's for me. And if it is, we're going to make some changes.
Insulin you inhale. Ask your doctor if Afrezza is right for you. Go to Afrezza.com to learn more.